Yeah, you forgot that part.
You ready now?
Yeah.
Okay.
So I'm just going to explain what's going on in the video so that we understand. So here we have a patient who was gracious enough to let us film this. He is coming in with swelling of his, what it says here, right thumb. And it's been going on for a couple weeks. So on and off. So this right here is something called a Paronychia, which is basically an infection of the nail bed. Or not the nail bed, I'm sorry. Basically, this region gets infected. It's a really easy area for pus to collect. So after it gets infected, it collects the pus, and then there's not really a way for it to escape. So what we do to treat something like this is we basically have to open it up. So he's already washed his hands thoroughly. He works with steel, so that might have been one of the ways he got exposed. So we're just gonna wipe with alcohol. This is not considered a sterile procedure, so. And then we will use a hypodermic needle to release all of that pus that's stuck underneath. You know, I promise I'll try to make sure it doesn't hurt.
Okay.
Alrighty. We got a good view. Come back over on this side so they can see it next to see what's going on. I'm just gonna take my stethoscope.
Where's the chair? Where's the chair?
No. Okay, so here we have the needle. We're just gonna go right underneath and lift. And you can already see the pus coming out here. Zoom in, like bring it closer. Perfect. All of that was stuck underneath. Can you see it?
Oh, wow.
Yeah. So that's just with one lift. I'm gonna go back in. Did it hurt?
No,
Yeah.
no, not really at all.
No. The way I do it tends to be pretty painless for patients. So we'll just wipe this off for right now.
Ooh, it's a lot.
It is a lot, and there's still more. You can see more coming out. See, once you release the pressure, all of that pus just wants to flow out because the pressure has been building up for so long. Yeah, so with people who do not have risk factors, oh, we got even more coming out. For people who do not have risk factors such as diabetes or any autoimmune conditions or who are immunocompromised, no antibiotics are needed. Okay, you wanna bring it down here? Doing okay?
Yep, no
So we
problem.
got more. Now we're gonna get a little blood out. Let me know if it's painful at any point, okay?
Okay.
Still not painful?
I don't know. I definitely feel the pressure releasing.
That means I'm doing a good job. I definitely don't want to be causing you any unnecessary pain. If you're a provider who's watching this and you've never seen this before, just take a look at the technique, because I have seen some providers or heard from patients of providers stabbing directly into this inflamed area, which is extremely painful for the patient, but also unnecessary because it's not required to get the pus out, right? Just lifting up this cuticle releases all that you need to release. Sorry, I just knocked into you. And because it's been there for a pretty decent time, it's kind of spread over to the opposite side of the thumb. So getting more. If this goes on long enough, you will develop something called a felon. So if this is not treated, it'll develop a felon, which is an infection of this portion of your finger, which is a lot more difficult to treat. So this is very easy to deal with. Once it becomes a felon, now we have to consider cutting into the pads of your fingers. Now we have to consider antibiotics, and it just gets really complicated. So if you ever end up with something like this, just come on as soon as you notice it. Any urgent care should be equipped to deal with that. You just need this kind of needle. Doing okay?
Yep, no problem.
Now that we're getting blood, this is usually where it starts to become a little more painful. Or a little more uncomfortable, I should say. Your blood almost acts kind of like its own cleanser, right? Because it's liquid and it will kind of push out all this other gunk. Let me know if at any point it's painful and uncomfortable, okay?
Okay.
I'm just gonna lift your finger. We got some more. Can I pass it on? Sorry. This is a part that's probably pretty tender, right?
Mm-hmm.
Okay. We've gotten most of it out. You did okay. And now you can see some of the chunks that are coming out. And those are called loculations. That's just basically when all that pus starts to gather up in clumps. And we just want to make sure that we can get them out. Okay. I'm gonna push a bit, okay?
Yep.
I'm sorry, because this usually tends to not be the most fun part for patients. Let's see. That is more loculations. I don't know if it's focusing. Mixed in with some blood. Make you uncomfortable once so that we hopefully don't have to do this again.
Okay.
And then again, if this ever happens, you just come as soon as you notice it developing. Usually within like the first day or two, there will be enough pus for us to be able to release it and just help it from progressing, getting worse and getting more painful. You're doing great. Okay, I think we're good. I'm sorry. Here you go. We are all set. Where's the cap? And here's how you always cap a needle. For anyone watching who deals with needles, you are never going to pick it up and put it back on. You are always going to slide. And that's it. And then push down. And sharp container. Yep.
Can we shut it?
Our sharps. Huh?
Can we shut it?
Yeah. You can. So
Sorry.
everything always goes in the sharps container. Close. Oh. Okay, perfect. Assalamu alaikum guys. What you just saw was a video of a Paronychia release, and so that is basically an infection of the nail bed right around the cuticle, and it can be a pretty painful infection. A lot of people would think that, you know, it's small, it must not be that painful, but it can be really uncomfortable for patients. So this video is just meant to educate people on the proper way of actually releasing the pus, because I've seen and heard of providers doing it in a way that is much more painful, and obviously nobody should be doing this at home, but realistically people probably are going to. So I'd rather you see the proper technique and you know to use a sterile needle, so that you are not risking further infection. Now, he was not somebody who had any type of risk factors to need antibiotics, but just know that the way we approach this type of infection specifically depends on the extent of the infection, how long it's been, and the patient's medical history that they have. So not every Paronychia is going to look like this, and because of that, there might be some differences in treatment. So you might have been put on an antibiotic if you had a Paronychia, or might have seen other people put on antibiotics, but typically most of them tend to resolve pretty well with release of the Paronychia and proper hand hygiene immediately after, so that if it's recollecting while that cuticle is still lifting, you're getting that soap and water into the area to help remove any of the debris so that a new Paronychia does not develop. I hope it was super helpful for you guys, and please, if you like these types of videos, the only way I'm going to know so that I can keep posting them and keep remembering to fill them and post them is if you leave a comment in the comment section and let me know that you're enjoying them. I'm sure there are plenty of patients who are willing to be on camera if it means that you guys get the benefit of being educated on their condition. Thank you so much for watching. Like and subscribe. And see you later. Bye.